Hi, I'm Thomas, massage therapist at Advanced Spine Joint Wellness, and I'm going to talk to you today about TMJ and what massage can do to help release that. Now, TMJ is also known as lockjaw, and there are 4 muscles involved in moving the jaw in the chewing motion, or what we call mastification. Now, lockjaw occurs when these muscles, or the joint itself, the TMJ, or the temporomandibular joint, lock up. When those muscles tighten up, it can cause pain. It can be difficult to open your jaw and to move it around. Or if there's damage to the joint, it can also cause this as well. So what massage does is it focuses on those 4 muscles, the medial and lateral pterygoids, the masseter, and the temporalis. Each of these muscles is involved in its own way. There are many ways to work the massage, so we could just massage in the temples themselves, and that will begin to release some of the pressure on the jaw. And then we could get closer to the jaw itself, which is going to be closer to almost the ear here. You'll feel this little nodule here, which is actually part of the jaw itself, and that's right on top of the joint. And as you work around in there, we just look for small little trigger points. And as a therapist, we're trained to look for these and isolate these. So just by massaging it, you're pushing the blood out of the area. It can be a little intense, so always ask with your patient, make sure that if they're in pain or if it's too much pressure. And then some things we can do, once we find those trigger points on these muscles, we can hold pressure on them for a certain amount of time, sometimes 30 seconds, sometimes longer. And as we hold, we can even have the person open their jaw and move it around. So go ahead and open your jaw. And relax. Now, normally we would hold it much longer than that to get the muscle to fully relax. Now, the hardest muscle to get, and one of the ones that is most involved with lockjaw or TMJ, is the medial pterygoid. Now, don't worry about the Latin behind it. Just know that this muscle is very difficult to get to. The only way to access it is to go through the inside of the mouth. And this is a technique that we do here, and many other massage therapists may be trained in it as well, but this is one we specialize with. To get to the medial pterygoid, I'm going to have my patient open her mouth, and I'm going to take my finger and run along the top row of teeth, along the outside of them, but inside the cheek, till we get to the very back of the jaw. There you will feel the muscle, and if it is locked up, you kind of have to fish hook them in there, and it's not comfortable, but as you hold that muscle, I'm going to have you open your jaw a little more if you can. Now deviate to the right. Perfect. And just hold. And as you hold that pressure, that muscle will slowly release. And this is a good time where, we might practice a safe word with the patient. So tap on the table if it's too intense, or just give us a signal. That way we know to relax. And go ahead and relax. TMJ is a very painful condition, and even in mild cases can be very difficult to treat. But in a combination of physical therapy, even forms of chiropractics and massage, we can really help heal this. So come in, talk to us if you feel like you're having any of these issues, and ask for one of us massage therapists to work with you. Take care.